So thank you for coming and doing this. So I'm Charlotte Stagg. I'm one of the organisers of the Centre for the Creative Brain, which many of you, I see many familiar faces, which is lovely. For those of you for whom it's the first time, the Centre has been running for, this is the end of our 7th year. And we run an event a term around, loosely interpreted, the idea of the interface of neuroscience and creativity. And we've had a variety of really fascinating events, of which I am completely certain this will be another. So I have a few thank yous to make before I make my introductions. So first of all, as always, a huge thank you to Teddy Hall for supporting us and funding us, and for the Wellcome Centre for Integrated Neuroimaging, who also fund us and support us. We are very, very lucky to be able to put these on for free, and we rely on their goodwill and support. So thank you to them. And thank you hugely to our committee, and particularly Kenny, who's hiding back somewhere, who has done all of our work. I'm going to pretend I did everything apart from turn up. So yes, these really, really wouldn't run without our fantastic team of undergrads and graduate students. So thank you. And most importantly, thank you very, very much for our speakers. We are having had a sort of a run of global events, international events online. This is our first international event in person, so we're absolutely delighted to welcome Sarah and Tammy from far afield, and Arjune from less far afield. Equally welcome. So I'm sure you've seen examples of Sarah's work. We were absolutely delighted when she reached out to us, gosh, a year ago? Yeah, goodness. With a PowerPoint of some of these artworks and said, is there something you might be interested in? And this has really come as a, sort of, as a result of those conversations where the more I discovered about Sarah's story, the more fascinated I was, and the more I thought this is something that we're delighted to be able to explore. So I'm delighted to welcome Sarah and welcome Tammy, who's the art therapy manager at the Cleveland Clinic for Arts and Medicine. I have to write these things down, but I get them later on, I apologise. Who are both very, very welcome from the US, and Arjune Sen, who's a consultant neurologist at Dormantford, who is here to give us the neuroscience perspective, neurology perspective. So I'm going to shut up and leave it to the interesting people. Thank you very, very much, all of you, for giving up your Friday evening, and over to you. Thank you.
We're going to define art therapy a little bit so you have a bit of an understanding about it before we start. We're going to talk about the Seizure Assessment sculpture, which is kind of the inspiration for Sarah to create all of her own sculptures. And then Sarah is going to talk more about exploring her own epilepsy and the art she created post-brain surgery. And we are also going to add in a little bit about visual expression as a healthy way to cope. So this is my slide I use all the time, definition of art therapy. The ATA is American Art Therapy Association, and that is their big, long definition, which is nice. The Arts and Medicine at Cleveland Clinic, we whittled it down. So basically, it's so when we go and see patients, we can explain to them what art therapy is in a way that they will understand and not be frightened by. Because sometimes when you use word like applied psychological theory, it frightens people. So we're really engaging people in the therapeutic creation of art to assist with their emotional and physical healing and growth. The benefits of art therapy, it's a nonverbal form of expression. Within the hospital, it can help normalize the environment. It gives patients an opportunity to have choice and control. And that's one thing that's missing in a hospital stay. You're told when to wake up, you're told when blood is being drawn, you're told when everything is happening to you. But art therapy allows you to make choice again in the creation of your art. It promotes coping, again, through that nonverbal expression. It can divert from pain and anxiety to major issues in the hospital. And it helps them utilize their fine motor skills and move around a bit. There are generally two types of art therapy. Insight-oriented, which is what you're going to see, that Sarah's art is very insight-oriented. Creation of art with the goal of gaining emotional and cognitive insights about yourself as the patient. The art therapist processes that art with the patients, which is basically discussing it with them, talking about it, pointing out things that they noticed and asking the patient to talk about those things. The idea of it is to create a triadic relationship between the art, the therapist, and the patient. And when you're talking about the art, it is less threatening, theoretically, than just asking them about themselves. But we're still really talking about them. The other type of art therapy is art therapy or art-based therapy, which is the creation of art as a therapeutic process all on its own. So we might talk about the art, or the patient may not be ready to talk about the art and they just want to create it. That therapeutic process of creating the art is still art therapy. And a lot of other goals are met, especially in the hospital, through art-based therapy. Okay, so a long time ago, maybe not that long, Sarah was a student, an intern with me at Cleveland Clinic, and she created something called the Seizure Assessment sculpture. This became her thesis project and research, which eventually became this article. So I'm going to actually turn it over to her now and let her talk about this as I advance the slides.
Okay. So the seizure assessment sculpture in itself was defining the differences between types of seizures. It just kind of naturally came out on its own. When I had given the directive to patients to depict their seizure, we had identified that people with non-epileptic seizures and epileptic seizures depicted them in completely different ways, which was pretty kind of extraordinary for art. We'll go through a few different examples on how this kind of showed up in the art. So the directive, it was a very controlled study. The directives were the same. On half of the sculpture, I asked them to depict their seizure, if they could see it on the head with the pipe planers, the pipe, twisty pipes coming out the head. They could do it any way they wanted to. And then on the face, they were asked to depict their emotions relating to their seizures. And then the other side was just supposed to be depicting self, what that would look like. The big differences in these were the people who had generalized seizures would have these kind of fiery bolts of electricity coming out of their head. And it was all over the head. So it wasn't in any focal area, it was just all over. Some of them would incorporate the feathers, kind of like the fuzzy, foggy feeling, but that was kind of the main difference with the generalized seizures. Then the focal seizures would be completely different. They were more curly, more inward. They were typically in one location. We had wanted to do a secondary study to follow it up to see if it would then, the patients would localize it in one area. We didn't get around to doing that, but this was really fascinating to the point where they would kind of localize it in one area of the brain, different from being all over the brain comparatively.
And it was generally the place they were actually having the seizure.
Mm-hmm. And then they often depicted their aura, if they're having one on their face. Like for this patient, she had like tingly feelings on her face. She would say like ants. They also much more emotionally dysregulated than other patients, and you could see that when it came out on the facial representations. And then we come to the non-epileptic patients. Their seizure depiction was drastically different than the epilepsy patients in themselves, and this was represented by an inward or encapsulated representation of the pipe planers going downward. So instead of coming off the head like a fiery electrical appearance, they manifested it in the same way they manifested their stress going inward. So for the medical field, right? Yeah. Do you want to explain?
Yeah, so just so before we so seizures are abnormal And that network can be focal, so it can start in one part of the brain. So, for example, if you have a stroke, you have brain injury, then seizures might start in that one part of the brain. They may then spread, or it can be generalized. And generalized epilepsies may be genetic. For example, they may have had a specific gene alteration from birth. And those discharges start all over the brain. And that's what you're seeing in the art here, is the difference between the focal and the generalized epilepsy. And then non-epileptic attacks are attacks that can look very much like seizures. And even clinically at the JR, it can be very difficult to tell a non-epileptic attack from an epileptic seizure. Neither are voluntary. But a non-epileptic attack is an attack that looks like a seizure, but there isn't electrical activity that's abnormal within the brain. So the networks are firing correctly, but there is still a non-epileptic seizure. This manifestation which you're seeing here.
So this one was, this visual depiction was really shocking when we did it, because that manifestation of how the stress was being represented visually came up in the same downward representation of how it was being manifested in the body. So they put all their stress down inward their body, and there was not the electrical activity in the brain. There was also this very astounding depiction around the eye that always came up, and we talked about the emotional trauma on the face, or the high emotional intensity that would happen in the patients. And like I said, with the focal seizures, you would have, they represented more emotion. With the non-epileptic patients, this representation around the eye that was more enhanced came up in almost every single one of them.
And so because of doing this study in the hospital, Sarah was inspired to explore her own epilepsy through a series of sculptures that she is going to show.
So I had epilepsy since the age of 3, and then I had gone through multiple medication trials, various types of seizures, from generalized, which we talked about, then to focal seizures, and then I had got progressively worse to the point where I had to have brain surgery, which was a treatment option, but presented to me at the age of 23. So we will go through some of the, I say, layers of epilepsy that typically someone will go through in treatment options, or treatment to cope with epilepsy or psychological changes, things like that. When I did Brain on Fire, I wanted to represent the same electrical activity in the brain where it would be my generalized seizure. Because when I had seizures young, I would have generalized seizures. And the black was for the shame and stigma I felt when I would have them out in public, because there would be so much, you know, everybody comes around you, everybody watches you, all the eyes are on you. So that for me was the shame for me around that piece. The aura is more so relating back to that piece that we talked about, the focal seizures. I wanted this one to be very localized in one area of the brain, but again, I wanted the pipe cleaners to be different. For this one, I chose very vibrant colors because the emotional regulation for me was very more intense. When I would come out of the seizure or be really, I would get more angry because I would know like it happened again. I had tried so many medication options, so many different figuring out like what to do next and following all the rules, and it just was not stopping. So I would become, you know, really upset, really irritated. So for me, the emotion dysregulation was more intense than what it was just wiping out and being kind of unaware. The squigglies on the face and the throat are the, if you want to explain them.
Yeah, I'll ask the question in a minute.
Okay. The aura is, for me, a weird feeling that I have right before I have a seizure. So it could be a weird sensation, a funny taste, a funny smell, and it could happen right before I kind of blank out. A partial seizure, focal seizure for me might be when I stare with my So it would not be collapsing, falling all the way to the ground, but I would be not consciously aware of what was happening. My most common one, which I could not describe here, would happen in my gut and kind of rise upward, and I would have this kind of rising sick feeling. And the most unusual one I have kind of recently is kind of this floating feeling. It's not a dissociative feeling, but it's kind of like I'm above my body. It feels very unusual, feels very weird. The best way I could depict that was by this tissue paper kind of rising outward, and I will let you kind of...
Yeah, so again, the focal seizures can manifest in lots of different ways. So wherever the abnormal discharge results in the brain, that will result in the manifestation of the seizure. For example, classical discharges in the motor cortex and the hypnosis seizure, where an end-way jerk, for example. Whereas if you have seizures arising in the temporal lobe, so memory, you may have some use of deja vu, for example. But as you've heard Sarah articulate very eloquently, seizures can have a wide variety of manifestations. You can imagine that can be quite difficult to diagnose epilepsy if the symptoms are these focal seizures rather than convulsive seizures, which are a bit more easy to recognize. I guess the question I think perhaps is about the typing and colours. So did you find when other people were choosing colours when they were depicting focal seizures, did they tend to choose bright colours, or was it a variety of different colours?
In the seizure assessment sculpture, I gave them every type and color available. And they would choose either these very bright ones or very sparkly ones.
Did people tend to choose the same type? So if they did a repeat sculpture, did they tend to choose all bright or dark?
I guess to clarify that, the non-epileptic patients would choose the reds, the blacks, the blues, and the epilepsy patients, what either type, focal or epilepsy, would choose either the bright fluorescents or the sparkly ones. Over-medicated would describe part of my childhood, my adolescence. Treatment now is very different from when I was a child, I think, and you clarify this, 2 or more medications before surgery is an option. Is that correct?
Yeah, so normally now, so if you have, because epilepsy surgery can sound super dramatic, but actually it's a very, very good treatment option. The medications don't suit for focal epilepsy. So if you have generalized epilepsy, seizures, discharges all over the brain, then it's difficult to identify the focus that you can detect. Yeah? But in focal epilepsy, the seizures start from one part of the brain, you can show the seizures arise from that area, and you can think about removing that area of status matter. But that bit of the brain isn't working quite correctly, so you can potentially remove that to try and help seizures. But still now, actually, a lot of people go through a long pathway with lots and lots of different medications to try and settle the seizures down. And actually, if you try 2 or more medications to try and control the seizures at appropriate dose, and the seizures aren't controlled, then you can classify this drug-resistant epilepsy, and then you should at least be offered entry into an epilepsy surgery program. It doesn't mean that you will end up with epilepsy surgery, but there should at least be an evaluation for epilepsy surgery to see if that's appropriate, to try and avoid over-medication. So to give you a ballpark perspective, so if you have drug-resistant epilepsy and you're a good candidate, ideal candidate for surgery, it's about a 70% chance of seizure freedom with the operation. If you have drug-resistant epilepsy and you keep going on the medication path, it's about a 15% chance that you'll get to seizure freedom. You can still have seizure improvement, but seizure freedom is much harder.
That's so beautifully said, because when I was very young, I think I went through like maybe 8 different types, and it was the levels were just up and up, and for someone very young in adolescence, you have very big side effects of those. With any medication, you're going to have side effects.
And I guess also the other thing is that the seizures are episodic, so this is why This is why it's great there's so many of you here, that's fantastic, because epilepsy does live in the shadows, even within neurology, because it's episodic, so you won't see the seizure unless you have the seizure at the time, you're there at the time of the seizure. But if you're taking a lot of medication, that's with you all the time, so you're constantly exposed to the medication and the side effects of those medication to try and stop an episodic condition that people don't see and don't necessarily understand.
Yeah, and it was just such a big component of your life. It's just the daily routine, and for me being young, it had a lot of negative effects on the first one I think I gained 15 pounds on it. So you have a lot of thoughts develop about yourself, of who you are as a person, things like that. But I mean, you do what you need to do to get where you need to go, and this was just one of those layers where it was one of those steps where I needed to go. And some of it had negative consequences, but we're moving on to where I needed to go in my journey. This next one, I don't want to talk about it. Actually really relates to depression. So, you're going to see they all kind of build off of one another. They all kind of have layers added to one another. This one, I had kind of looking at it, it almost looks like a shield. If you think of armor, like a knight, which I didn't notice until later.
That was an art therapy thing. When I looked at this with her, I said, "Oh, it's like chainmail." She's like, "Yes, yes." So when I got one, I got one.
Art therapy is really kind of neat, where when I chose these materials, I went into an art store and I just gravitated towards what felt right. And we have this saying in art therapy where sometimes the materials choose themselves, So we say kind of that's the magic of art therapy. When I initially created this piece, I wanted it to be mechanical pieces that didn't fit together right. They were there, they had all the operative pieces to be functional, but they weren't working together in one unit. This will come back around in layers of kind of defense mechanisms later when we get to the second part of the show. But for this piece, I wanted it to have a very inward look. So when you have depression, you aren't very focused on other people. You have a very inward look about what's happening. You're very focused on what's happening in your life. And it's hard to see outward because you're so focused on your symptoms, your thoughts, what's happening with you. So this had all the materials, but it wasn't functioning the way it needed to.
And I'm going to jump in because you just reminded me of something. And so if you look at this one, the eyes are blank. There's nothing. There's no pupils. There's nothing in them. With patients with depression, you will often see that happen in drawings and other things of figures, that the eyes are not looking outward. So it's that subconscious idea of that they're not seeing out, they're only seeing in. They're only looking at themselves. So I think that's...
I'll ask a follow-up question on that. Mm-hmm. So because depression is very commonly associated with epilepsy, it's like people have seizures and depression. If people with epilepsy and depression do the self-cure, is it different to people with depression who don't have epilepsy? Are there differences between the two? Are they quite similar?
There are, so it's pieces, and sometimes it's just something like the eyes. When I worked in a mood disorder unit for a while, so I was just seeing depressed patients. And I kept seeing this lack of pupils, which was odd to me because other people without depression do not do that. Most people will draw pupils. And so then I started investigating that and saw that. So I don't know if patients with epilepsy do it differently, but it certainly showed up here. So I suspect that that's a symbol of the depression, not the epilepsy.
Yep. Starting over again is really about anger. When you have seizures constantly and as frequently as what I did, I wanted to represent the anger I felt not having independence. So for me, it was driving is a big one. All right, independence, especially in the U.S., you get it, your keys are representational of your independence. You get to go, not anywhere you want to, but you get your freedom. Along with that comes just different relationships, friendships. You aren't always hovered around 24/7. So every 6 months, it seemed to be like, boom, right on the 6-month period, 3-month period, I would have a seizure again. I would become very angry, which also led into the depression, because I felt like everybody else had the keys to my independence. So I wanted this piece to have the bread for the anger, but to have all the keys, it says like dreams, hopes, journey, things like that, to represent how everybody else had those, but I couldn't accomplish my simple goals for me.
I think it's important to emphasize just how important driving can be. And you don't know that until you can't drive for whatever reason it happens to be. So, and even in older people, so there's work done on older people looking at epilepsy and driving, actually driving is a massive aspect. But then when they looked at the data more closely, what a lot of old people need to be careful to get to hospital appointments, which is very important. But the driving can be really important. So I worked in London for a long time, and actually there it's much less important because you've got the entire Transport for London infrastructure around you, and you get Oyster Pass if you can't drive for a medical reason. So you can travel long distances across the whole network, but that's very London-centric. That doesn't apply right here, by those candidates.
It's a play on memory. I have temporal lobectomy. I had a temporal lobectomy, but my memory is completely kind of shot in one area. Memories for me feel like they are kind of outside of me. So for the white pieces kind of scattered, the foam pieces represent how they're not easily accessible for me. So I say that because if someone were to tell, like if you would tell me about your life, it might trigger something from my past, or it might trigger a memory. Like I could say something like, you told me about your childhood, I might say, oh, that might trigger something about my childhood, right? But I cannot easily access something about my childhood to tell you about my childhood. So I'll say that memories feel like they're outside of me, or other people get a hold on my memories, which is the purple sculpture. I'll say other people are my external hard drives, because they get to store all these memories of me and they can have them, but I don't really get to have all those memories for myself. Now with music and art, those things kind of get triggered, and I can kind of have this joyous moment where I'll be like, I had a memory today and they all came back, or one of them did, and that kind of makes me feel like less depressed about things. But for the most part, when you don't have memories of who you are as a person, it doesn't feel like you have a solid identity to go back to or to refer to. So you kind of, for me, it's like I don't know a big part of who I am. So because of where my memories have been lost, my brain hippocampus was removed. I don't have memories of who I was from 23 backwards. So for someone to say, tell me about who you are, Sarah, I'm going to look at them and be like, I can't. So this one was really about having that deep loss, that sadness. That's why the white sculpture is really kind of blank and empty, not knowing how to really be connected to yourself unless something gets triggered or brought up.
One of the things we talked about around this sculpture too was that the way memory works for all of us is we remember the last time we remembered something. So we're basically looking at a photocopy of the original event, right? So Sarah's memories are other people's photocopy. So she's got memories now that weren't hers. That it's just fascinating.
Again, just to emphasize that memory difficulties again are often even more difficult than the seizures themselves, because the seizures can be episodic, but the memory difficulties aren't there, and can be very, very first place, to get through that fog of medication. So if you haven't registered the information, then you can't record it. And if you're also reliant on the external hard drive, then you sort of remember almost false memories because you didn't register it, and then someone tells you what happened like this. And sometimes people describe lack of confidence in their memory. So if the memory may be there, but you're not completely confident that it's absolutely accurate. That's, I don't know, that's
Yeah.
Well, and that's the psychosocial stressors of, if you ask someone about their childhood, they'll tell you. But if you ask someone with epilepsy and they can't, that feels like, again, you're different. Even if you're, not having seizures, even if you're much better, you're still feeling different. So.
So we've talked a lot about, these layers, and we've talked a lot about, how you get up to the surgery part, the transformation is my surgery sculpture. So I went through all these layers of depression, shame, sadness, treatment options for medication, and then it was presented to me of, you're out of luck. We're running out of options. This might be a good one for you because we've tested everything that we could test for you. Okay. The mechanics on the side of the face represent how the seizures impaired my speech and my memory comprehension. So I was, at the age of 23, I could not comprehend a paragraph and understand it. It's interesting talking to you guys today, being in this position and having done my master's degree. When I look at the sculpture and say, wow, at that time, you couldn't read a paragraph and understand it. So it's kind of this really surreal experience. And also my speech was very impacted. I would just pause for long periods of time and could not get the words out, which I'm sure you see in clinic. That part was depictive of what it was like before surgery. My key to success was surgery, which I don't know if you can see on the top right. There are keys where my head was cut for surgery there. I wanted to represent that somehow. And my keys were allowing my abilities to bloom and blossom, which is represented by the flowers. And then there's butterflies representing transformation of self. The face actually disintegrated when I sprayed it with sealer, which I thought was really interesting because my art was never this way before surgery. I was very much a perfectionist and a drawer, and afterwards I did not want anything to do with it. And I became this very sculptor, builder. I went and changed my degrees to ceramics, so it was just a complete kind of identity shift.
This also, the sculpture, and you'll start to notice, this is the first time that organic materials, flowers, live things start to show up. So,
before we talk about this next section, I guess this is going to have a large portion of what we would refer to as the burden of normality, coming out of surgery, going from chronically ill to suddenly well, and that term is directly coordinated with the research of Dr. Sarah Wilson in Australia. I wanted to throw that out there to give her credit right now. When I did my art, I did not know her at all, and it just so aligned that my art aligned with her research. She's a fabulous source if you're interested in learning more about her and rehab for brain surgery afterwards. A large part of the rest of my work is going to be about kind of untangling the psychological changes post-brain surgery and what that's like to go from being, what she'll say is you have been chronically ill for so long and then you go to suddenly well, but you've lost all your developmental skills during that time. Now how do you cope?
or never gained them.
Or never gained them. So for this one, let go of everything I knew before surgery, which was very little as it was. Besides the constant medication changes, the medical trips, the scans, that's what I knew about who I was as a person before surgery. And then be open and willing to, who is Sarah now? What can I welcome now? What is the experience? And there is this part called prehabilitation that we would like to start. What Dr. Wilson has started to emphasize in clinic is how can they prep people for surgery beforehand? What are your expectations? So for me, my expectation was I'm going to have surgery and everything's going to be fixed and I'm going to be normal, which is not the case. You go through a lot of changes after surgery, and it's not just I'm back to, normal.
So I saw a patient yesterday who's been planned for epilepsy surgery, and you have to sort of just control that a little bit. There can be an expectation that actually seizures will stop and medication will also stop. It all takes time. And of course, one of the things is the journey for you from seizure onset to surgery was extremely long. And I do wonder whether if we could shorten that, then prepare people, then it's much more immediate, and therefore that's sort of the embedded things are less, you see what I mean, phrasing that.
No, you are. And the other thing is, we had talked about the age of onset. So mine was very, very young, but then they went away and came back when I was adolescent, which is, the identity stage. So you kind of absorb everything in your surroundings and people. So how much of that is the epilepsy and how much is ingrained and how much are you taking on from society messages?
And there's a disruption of the normal adolescent growth, even once you forget it.
And I think also, a lot of people study a lot of neurological conditions, but it's very rare that people with that condition say that they have shame as part of their condition. And that's something, that still happens in the US and in the UK. And we have to destigmatize in that broader sense epilepsy, so that it is, so people would never say, I have shame about being asthmatic. You are asthmatic, or you happen to be left-handed, or you happen to have diabetes, or you happen to have another neurological condition. It does seem to associate regrettably with epilepsy, and something we should really work on.
Well, I remember people when I was young saying, pray harder, pray away, and I was like, I can't pray this away. It's not going anywhere. So even that, we hear that still today. I'm on a board, sit on a board for Empowering Epilepsy in the U.S., and that was still brought up on social media, you need to pray harder, and you're like, that's really needs to be debunked.
Absolutely. So, and I think that there's a big concept that this is what happens in resourceful settings. In those middle-income countries, there are concepts relating to witchcraft and possession and contagion from seizures, but it happens everywhere. There is part of it everywhere. And one of the things, just as an aside, that came out during the COVID pandemic, because we have to mention COVID somewhere. So we had quite a few people with epilepsy who said that they had become their world had collapsed inwards, and they had become very introverted. That happened for a lot of us during COVID. But their real concern was that if they went out and had a seizure in public, let's say waiting for a bus or something like that, and there was someone who was seizing the frothing at the mouth and so on and so forth, if that happened in normal times, then people would go and help. But with COVID, a respiratory transmissible illness, then their real concern was no one will help me, and I will just have to then deal with it. So indirectly, society then limits people. So that's okay with me.
Yeah. Well, going back to it, just shame is just so high. You don't talk about it. I think we can get into that later. trouble is a big developmental shift of learning about life, all right, learning how to be independent and learning how to fit in with society, and I was not good at it. So I lost so much developmentally by the time I was that 23-year-old adult. I didn't know how to do like the billing, the electricity, the parking tickets, anything that you would naturally develop into over time and learn why you needed. In the U.S. you need insurance for everything. And I was like, why can't I just pay a bill and be done with it? So I wanted to emphasize this by monopoly. And Tammy will talk about my impulsivity during this time. But there was this learning curve that I just did not have. I could not pick it up, and it was so frustrating for me because the budgeting was one of the worst things that I couldn't manage it.
One of the things she's referring to is when she came as a student, I knew that she had epilepsy, I knew she had the surgery, but what I didn't, I had never had a student who had epilepsy or history of it, and she was very impulsive and she would say things. So you're learning to be a therapist, and she would say things that were not appropriate, or she would type an email. There's the famous story. She typed an email to someone, and I was like, oh my God, I can't believe you sent that. Like, you can't speak to people like this. And we would have these very gentle and kind, hopefully, talks. She tells me that they were about that. And so it really required me grasping that this was a person who had technically a brain injury. So she was very similar to those kind of patients at this time, that she was recovering from that, and she wasn't going to come to me like any other student. And so we worked on that impulsivity, and she was a great student for that too. And to her credit, and I think that's why we talk about this a lot, is that she hadn't learned the skills. It wasn't that she didn't want to do it. No one had ever told her or taught her these things. So she was able to learn that and pay her bills and not send anyone.
Well, yeah.
Sounds like you all need your
There's a big, and Arjune, you may notice this, as far as I notice it in clinic when I work with people who have epilepsy, there's a difference on some patients who you teach them skills, and there's that willingness and strive to, like, I either don't know it and I want to get better and I have that strive to get better, or there's that fear of that dependency. Which, in my case, like, I wanted to do it so badly, and then I was just like, there's a connection here that is just missing where I can't make the connections, which is where we would go. I'd be like, she would tell me something and I would be like, I just don't understand. I'm out on the blue and I'm not getting it, help me out.
Right, and that's why she actually got better with those social norms, because she was willing to learn. She was willing to ask about that and hear, this is another way you could do this, is another way to handle it. So I give her a lot of that credit that she was, because some students now, again, who come in, quote unquote, normal, do not have that and get into a lot of trouble. So.
My game of life, the next one, is representing all the responsibilities you can gain after surgery. And again, this kind of goes back to why that pre-rehabilitation is so important, because for me, it would have been very, very helpful if someone had said, when you're going through surgery, you may, hopefully, our goal for you is that you will be able to gain your full independence and have these, live a full and healthy life, which comes with these responsibilities. There's a cluelessness there was for me. I can't say that for everybody. I didn't know about the responsibilities, and probably at the time I would have not been very aware of what all of those were. But when prehabilitation comes along, there is this mass amount of, when we say compassion, for me it would have been helpful as far as saying, Sarah, our hope for you is that you would live a full and healthy life. But with that option happening is going to come all these responsibilities on top of it. And in kind of sharing that with me in a way that's going to be kind and compassionate and caring, what I got in return, not from physicians, but from society generally in messages, was grow up, get over it, move on, which was terrifying for me, especially when you don't have the developmental skills, which was significantly damaging because then I became very reactive. So if you think about not having a very compassionate environment and then having all these responsibilities just kind of, here you go, you're fixed, move on, get over it. It doesn't create an environment where someone's going to be very responsive, they're going to become more reactive.
Do you think that rehabilitation should be for the individual and their family?
Yep.
Because there can be very, very big impacts from epilepsy surgery on family. Even if the epilepsy surgery, in inverted commas, works, as in someone is rendered seizure-free, that can fundamentally shift dynamics within relationships and within families, between parents and children, and so on and so forth. Because just as you're saying, you go from someone who was having their condition to, well, you don't have that condition anymore, but it doesn't mean that everything else, that you can't undo all of the things that have happened, and so on and so forth.
And that's, we'll get to boundaries here in a minute, but boundaries in family systems was huge. And that was a big learning experience for my family. It still struggle, especially with me and Mom, because she had to move out of that caregiver role, and I had to be like, let me do it on my own because I'm not the sick one right anymore.
So there was also a study made, a study in Australia actually, where they looked at people after marriage, and sorry, not after marriage, they were married, and they looked at them after surgery, and a significant number of people were divorced after surgery, especially if you were female and you underwent surgery and became seizure-free, then you have that independence to perhaps think, well, that relationship was not built on the correct premise, and so that then led to divorce. And so that, I think that rehabilitation is key. We're now doing it here as well, and it's really important because it's a long pathway to get to epilepsy surgery, so there is time to get rehabilitation in.
Yeah. So when we talked about like having all those responsibilities and then having the environment where it's the kind of lack of compassion there, which leads to this next culture of, outbursts, get over it, move on. For me, that was, I didn't know how to meet my needs in a healthy way, so I became very reactive. I used the board game of outbursts to kind of make a comical play on how I behaved during that time. It's not funny. It wasn't a pretty time in my life, but I needed to represent it as some type of form of when you don't know how to meet your needs and there isn't a caring environment that's empathetic and people don't know how to adjust and the family doesn't have support or there isn't the rehabilitation, then you all become reactive and you're like, what is going on here? So this is just a comical play on that. So having all of those stages kind of played out and depicting how this lack of support and changes and transitioning led to Lady Liberty meets Frankenstein. There was, I don't want to say that my surgery was unsuccessful. My surgery was 100% successful. I went from having over 200 seizures a year to having one maybe once a year. I'm almost 3 years seizure-free. I'm excited about that. So I did Lady Liberty meets Frankenstein in 3 different colors. Yellow was first to represent the independence and freedom I had right after brain surgery. I wanted to depict that excitement, the joy I felt having everything back at one point, especially the driving. That was a joyous moment for me. But having talked about all of the things that we just talked about with trouble, get over it, things like that, I quickly added the green over top of the yellow felt like I could not be at any lower point than I had already been. So that really joyous moment went from, I just can't even fit in with my peers even after my surgery anymore, and I'm a total failure. And the nails, instead of having a crown of independence, like this freedom of I fit in and I'm normal, right? I'm alike. The nails literally represent like the critical statements I remember hearing, and just kind of that pain and discomfort I felt. And I had one seizure right after we had attempted no medications, and I remember that day where I had been told we're going to have to be on medication for the rest of your life, so I chained those around my neck like the bolts on Frankenstein.
Which, when we talked about this, I noticed, so the bolts on Frankenstein are what brings him to life, though. That's where the electricity comes in that brings him out. So as much as it's chained to it, you know, this medication is also, so this is one of those subconscious things that I love. The medication, if you may not like it, but it is bringing her into like a normal life. Without it, she has seizures again. She doesn't have her normal quote unquote life. So
I must say, I was saying earlier, this is my absolute favourite. So because I think it's really complex and it works at lots and lots of different levels. So for example, I haven't thought about that before, but so for example, there's far less medication now than there is in the early medication. And the nails are going in, so there are things coming really trying at you rather than things coming out and they have personal seizures. But it still has a very big effect, and it comes to this whole concept that epilepsy is more than seizures alone. You know, it's a much bigger condition than seizures. But that's my last thing. You can all have your own.
Well, this one, adding on to that, you guys think about it, when we go back to shame, when we go back to depression, those just compounded, all of those, again, they like reintegrated those, like that shield, which we'll see in the next one, will come up, like, I'm not sharing with anybody now, I'm not talking to anybody because I don't feel comfortable, I don't feel safe, and that people have just told me, get over it, grow up, move on. Well, I already didn't fit in before, and now I sure as hell didn't fit in now. So it just like really created this big guard that I wasn't talking about it anyway. So if you think about when we talk about those layers, when you say it's more than just epilepsy, you have to go through all those layers and work through those. This one is called the trauma of epilepsy. I did them in two different pieces. One, the white one represents very naive, very childish before surgery, and then the black one is kind of the representational for how I felt after surgery. I always felt like I had a white, I would say after surgery, I felt like I had a white veil on before surgery because I was so naive, so childish that I didn't really see what the world was because it was just, there was such an innocent quality about me. After surgery, I would look at the world very evil-like, and I would say it's, in the U.S. is so, like, business mentality, like it's, that shift from so childish to so adultish so drastically was, it felt like that black and white starkness. I did not want to metaphorically see what I was born into because it was such a drastic shift. So for this one, I put the black glass over the eyes, and I wanted them covered because it was just terrifying for me. I did not want to see the manipulation, the business stuff, the rudeness. It would be the more rude mentality. The curly hairs are changed, the curly things, because at that point, when you change perspective so drastically, comes very distorted thinking. So one's good and one's bad, there's no middle ground. And that is another layer which takes time to work through, because when you are in a good place, you have a gray or balanced perspective.
it's also a great example of that. missing adolescence, you know, the stages of adolescence that she did not get to experience or did not remember experiencing, you know, went from naive childhood into sort of the cold, hard world of adults.
Angry critic just represents the way that I would talk to myself. You know, I'm a failure, I can't do anything right. I had really, because of the medications and constant weight gain, I would have really poor body image. I would really just talk to myself like crap and be really judgmental. So this technique for the cardboard on the sculpture was not my technique, but I found it tremendously appropriate because I was so judgmental towards myself. I was like, well, when you talk to yourself like crap, then you're not going to make it very far. So then I put it in the cage because literally when you're so judgmental of yourself or so critical of yourself, you keep yourself trapped there. You have to learn how to be compassionate and kind to come out of the cage and really give yourself a chance to open up and try and be kind. And that really is where it's at and moving forward. Disempowered happens when you totally buy into your critical thoughts and cognitive distortions, which is going to be those inaccurate thoughts, which we talked about in the trauma of epilepsy. So when my thoughts become so distorted about what reality is, which is they're unfactual thoughts, then it's not that I'm disempowered by someone else. It's I'm disempowered by myself. So I wanted this piece to be, I'm really disempowered because of the way I'm thinking, either about myself or the world, and I have to find a way how to untangle that and come out of that, which requires coping skills, which is a missing component and why we wanted to rehab with that. So the next section is going to be healthy ways of coping, which really looks at why rehabilitation is going to be so important. Really just because of all that complexity we just went through, like all those layers that we went through. And these are going to be kind of visual representations of how I coped. So this first one is about the red sculpture in itself is about cognitive distortions. The beads are my thoughts and how I get wrapped up in my thoughts. And then how they kind of tangle me up and how I get stuck and wrapped up in them and how I can't get out because of my thoughts and my critical thinking, which leads to the sculpture with the tape on it, which is about boundaries, which is what I was going to talk to you about. And with this one, I can't speak for everybody with epilepsy, but when I work with people with epilepsy, there is this component, and even I've had to learn for myself, boundaries are really important, and there is a cluelessness there if you don't have boundaries that will just ask whatever comes to mind or say whatever comes to mind. And if there's not that education component there, we just don't know. Like it's not given. So that education component of, you know, Sarah, you don't say those things. You don't write that email. And I would have known if someone hadn't taught me because it was just not even on the radar. A common one I see very often is, what medication do you take? You wouldn't go up to a stranger and say, well, what do you want? You know? But I hear that from people who talk to each other with epilepsy all the time, like, well, tell me about your medication, how much are you taking, you know, like, I would never come up to you and ask you, like, that question. I'm like, you need to have better boundaries. It's kind of like asking someone, you know, how much is in your bank account? You would never ask that question.
Just with that one, did you choose, because I just want to beads, why did you choose beads to represent the thoughts? Was there a specific reason for that?
No, just I wanted it to be kind of like the twisting of the knot, like the knots and the thoughts.
I just wondered whether it was like individual fragments of thoughts building together.
And there's an art therapy lesson on why you ask the patient what's in their art and not make assumptions. So thank you for that.
Thank you for making the assumption.
That's something that art therapists will do, or a young art therapist will do, is kind of jump to, this is what I think that means. And so you want to do what you did, which is actually ask, why did you do that, or what does that mean to you? Because we can transfer our own thoughts onto the other and get it wrong sometimes.
This one's about mindfulness. When I learned about mindfulness, I was like, man, why is this not being taught to people with epilepsy? Mindfulness, if you don't know anything about it, it keeps you present moment, just kind of calms everything down, pauses you, keeps you present focused. It's very, very common to go forward into the future and back into the past. We worry, I'm guilty of this, worrying about everything and then going back into the past. And when I learned about mindfulness, I was like, man, this feels pretty good not to do either of those things. So I wanted to depict this healthy coping skill by use of the kind of the greenery, the just calming, quiet, being in your own place.
So to a degree, we should all do mindfulness.
Yes. Yep.
And that, no, I was going to say, one of the things that when Sarah and I first looked at the full slideshow together was, I would say occasionally, well, that's something everybody goes through. You know, that's something that we should all do. Like, to sort of bring in that sometimes people who have an illness, who have something, define everything in their life around that and think nobody else experiences those kind of things. Like, it's because I had epilepsy, I didn't know about mindfulness, or I didn't know how to be mindful. When the truth is, most of us don't know how to be mindful. So,
mindfulness is the mainstay treatment for non-epileptic attacks. So this is very much about epilepsy, but non-epileptic attacks, mindfulness can be very effective. But we're very fortunate that we have quite a lot of clinical psychologists interested in mindfulness and non-epileptic attacks. So for John Radcliffe, and so as well as non-epileptic attacks, they will see people with epilepsy where mindfulness may be beneficial, or people who have non-epileptic attacks and epileptic seizures. And generally outcomes are very good. It doesn't suit absolutely everybody. You can't say that it's panacea, and it's been more difficult in the pandemic because they've had to do quite a lot of it on Zoom and in groups rather than more individually occasionally. But it is a very important part of epilepsy management.
This next one's about codependency and how we were talking earlier about boundaries. So codependency is when you kind of get enmeshed with another person's thoughts and feelings and how they, your work is involved. With this one, I did 2 sculptures, but they look identical. So my work is based upon what you think of me. So with this one, I was very much entangled with my caregiver, which my main one was my mom. She would take care of most of my seizures when they would happen. So with going back to boundaries, how you manage codependency is to have boundaries. You have to kind of cut the chains, and like you can take care of who you are as a person and manage your own thoughts, emotions, and behaviors, and be your own person, and then let me do that also. Arjune has talked, given some good examples about how that's disrupts the system that's been in play for a long time, and then it becomes a struggle after surgery is done, and people have a hard time adjusting. It's still a hard time, you know, with my family system, sometimes where I'm like, you know, you just need to go, you know, be you and let me be me, and I'm not having seizures like that all the time, and I understand that for many people who are in that caregiver role, I think there's also a trauma there for them, and they need help in a way of support and compassion, connection, which I want to validate for the caregiver, because if you can imagine seeing your loved one go through that all the time, how traumatic that would be for that person. That deserves a lot of attention, a lot of compassion, but also now who am I now that I don't have to be that person either? Who can I be now that I don't have to be the caregiver anymore? which for my authentic self started to be with self-acceptance of my diagnosis. I actually have epilepsy. This is part of my life. I'm not going to be shamed by it anymore, and I can get through it by just acknowledging that it's always going to be here. It's going to be part of what I live with for the rest of my life. This was the first piece I made actually out of the whole series, and this happened after I had a very important person in my life kind of retrain the way I thought about epilepsy. And this happened when it wasn't always a constant threat every time a seizure would happen. So for many people, it is a seizure happened, oh my God, the whole day stops, and are you okay, are you okay, are you okay? When I would have an aura or a small seizure, it was, okay, well, you had it, we're moving on now, you're fine. And that experience for me changed everything, because everybody wasn't stopping and was like not asking, are you okay all the time? And I wasn't in threat mode, and they weren't in threat mode, and I was like, this feels pretty good. So that acceptance part was really transitioning and changing how I viewed epilepsy as a non-threat anymore, and I had more control of what it did. Empowered self is about nurturing, and this one is about being in a supportive environment where I could have a voice and be equal to other people. I represented this one by the honeybee, where the honeybee is nurturing. And you can be part of an environment, but you also work individually. So this is the first one I actually included eyes with and opened and seen. And this one happens in the environment where I am currently working, where I have been surrounded with an incredibly supportive staff, and have had Tammy and other directors and supervisors in the past have been incredibly nurturing for me. And I say that because without that nurturing, accepting environment, I wouldn't know how to accept myself as a person, not the epilepsy. And that's really the second part of what comes afterwards. It's not just accepting the diagnosis and then you're done with it. It's okay, now how can I accept myself as who I am? And that comes with being provided a space where someone has actually shown you what that looks like. Self-validation came with knowing what compassion looked like. Compassion for me, as you can tell from the other sculptures, was not easy. I remember working with a therapist, and they would talk about compassion all the time, and I'd be like, can you just stop? I just did not know how to get to compassion. And I remember when I looked up Dr. Wilson online, that was the first time I had known that all these experiences were normal to go through. And that was one of the first times that I could say, okay, well, I'm no different than anybody else, which is why I say that pre-rehabilitation is so important, and then the rehabilitation is so important, because for about a decade there, it was, well, move on, grow up, get over it. But if you have someone that says, no, you're actually adjusting like anybody else would adjust, and this is normal to go through, it makes a big difference.
And I think you accepting that, because it is self-validation. Because
Yes.
people could tell you that for years, that you're fine. But it's until you get it, and I'm just going to point this out to you. This one I think is the opposite of that Frankenstein one, because now in the neck there are birds that are a symbol of freedom and flight. Like, they don't have to be there, they're hanging out, but they could fly away. And we've gone from that hard metal, nails in the head to growth. Beautiful things that are growing, and pink happens to be Sarah's favorite color, or one of them, I know that. But so I think that this one is just so great. So it's just that, like, the growth from that sort of self, flagellation, and taking in everybody's daggers, nails, to being able to grow and see yourself as something more than your seizures, more than your illness.
I think that's exactly right. If we have a difficult journey, we want to know that other people have on that difficult journey, and that they're not sort of way off. It's the same feeling being impacted in us that we can then recover. And that takes a lot of time. No matter what it is, whether it's grief, for example, whether it's epileptic surgery, whether it's an illness, it can be very difficult to get to that point. And once you get to that point, then hopefully you can begin to ease.
And that's, they're both beautifully said. That was, and doing it for me was the single biggest change and compassion. If you don't know what that looks like, if you don't know how to get there, a lot of times I'll talk in clinic with my patients about it really starts with accepting yourself, or accepting your feelings, or accepting what you're going through in that experience, and that it's okay to have whatever your experience is in that moment. For many people, we'll see them say, well, I've never been told that I can have my feelings or have any emotions or thoughts that I've been able to go through. And we'll say that's where you need to start, is just giving yourself permission to have whatever experience you have right now in this moment. And that was that transition phase where I was just like, okay, then I can give that to myself, and that was compassion for me. And it didn't require anything from anybody else, and that was where I was like, that's where that depression, like that mold broke, and I was like, I can do this for me, and I don't need that from someone else anymore. Did you want to? And then forgiveness goes back into, it's a releasing. It has 2 seasons, and it has the winter and then obviously the spring with the daisies. It's about releasing all the anger and what I had with the nails on the piece of the Frankenstein, to giving up, a falling, of releasing, a letting go of what was said or what was hurtful, to welcoming a new season at the same time. I was happy because the gold is there, because I did it. I could let that go. I could let the anger go. I could be in this freeing space, and the white on the face is unpainted, because in that moment I could recognize that everybody is human and everybody makes mistakes and everybody has their bad days, and I don't have to hold on to those things that are said, and I can just let that lift up, fall, release.
And how long did it take away from the sun foundation? Time.
That one, a year or so.
I think this one is great too, because it harkens back to the crystallized frozen face, one of the first ones that she showed, and now it is so much more of a celebration of winter, that and spring coming, and it's so, that one was very tight and enclosed, and this one is just really out there, large and beautiful.
This is one of my favorite pieces, the authentic self. It's really living by my own values and my own goals and reaching my own goals. And it's really kind of breaking away from that codependency to who do I want to be as a person? What are my own goals? What are my own goals? And I'm going to make up my mind to live by them no matter what, even if there is such a discomfort for me to, I guess personally, that chain, right, the piece we saw with the codependency, there's always been a discomfort for me to let someone down because of that wrapping. And I had to get to a to a point where I was just like, I can't do it anymore. I don't care if someone else is disappointed, because anytime I feel like I'm disappointing someone else, I'm actually disappointing myself. And for me to keep doing that pattern is ridiculous. So I have to get to a point of just, I can be okay with making my own decisions and living by my own rules in my own life, because that's where it really is. And for me to get to that point, I had to be so uncomfortable and miserable to be like, okay, well, it's time to change. It's time to then go for the gold and reach your own decisions, your own goals, because if you're not, you're just going to keep being in misery. And then this one's kind of just a joke, an elephant in the room, is how can we get this continued discussion that we've developed tonight keep going, right? So I did the Legos on, there are pieces there that are making connections that you see where I've started as coping skills. But there is the hole where I've had surgery where there's pieces just sitting there that can't make the connections to one another. So how can we, as a society, as a group, as a whole, like, keep the discussion going, reduce the shame that we've talked about, keep the discussion going on how can rehabilitation become included in treatment? How do we provide coping skills to people with epilepsy? What discussions do we need to have? How can we take this further?
I think this one is great too, because although they're, those Legos, that brain is trying to make those connections. They kind of reach into that blank spot. So just how the brain works, it reconnects with the brain. So this is the last slide. So if anybody has any questions, comments, we are open to them now.
In terms of clinics, just after the surgery, did you see the symptoms gradually recovering, or do you see really a big, sharp change, just in terms of clinics and symptoms?
Psychological symptoms?
Mm-hmm. And physical.
The psychological changes happened about the second year after my surgery.
Okay.
But like I said, my surgery was tremendously successful. I wouldn't, and we've talked, I would not have made a different decision, because I was having so many seizures that that was the end point for me. I would probably be dead if I hadn't made that decision. It was the right decision to make. It's just other components I would have involved was the pre-habilitation and then the rehabilitation, because those transitions would have helped clear a lot of those things up.
So that highlights a really important point, because again, you were saying that epilepsy surgery sounds like a scary thing, but you're balancing the risk of surgery against a very real risk of epilepsy, risk of injury, risk of head injury, risk of mortality. So you're not balancing this against a benign option. This is a very severe option, and that, it sounds, going through the story is amazing to listen to, even though I've seen the slides and I know the story. But what that teaches us is that obviously surgery could have happened earlier, but it wasn't the surgery wasn't the difficulty, if you like. That was the right thing. It's the prep for the surgery, looking at everything much more holistically. So beyond you as the individual undergoing the procedure, which is what the rehabilitation is all about, and the rehabilitation afterwards. But I mean, one thing that I think is we don't have art therapy here for post-epilepsy surgery. So
There is the British Art, I have to say, there's the British Art Therapy Association. So, but yeah, I think it does not exist everywhere for epilepsy, but it's a great tool.
being transformatory, really.
I mean, the truth is that if Sarah had not become an art therapist, she probably would have still done this art because she was already artistic. But getting people who are not artistic or don't view themselves as artistic to do art and express some of these very difficult things is a key component of art therapy. And it is much less, you know, as you can see, if we talk about this sculpture, instead of I'm not asking Sarah, so how does it feel to have, you know, we can talk about it in the third person, in a little less directly, it's a little less threatening than to talk about that girl with the Legos on her head on the screen rather than this one sitting right here. So,
do people tend to read that way? Do people tend to start in the third person and then become in the first person?
Yeah, we talk about the art first, and the art therapist really talks about the art. It's intentional. You know, they're given the supplies. If they're not sure where they want to start or what they want to do, we'll offer options. So there are going to be several different things. When they did the seizure sculptures, that was the option. They were asked if they wanted to complete that. Most of them said yes, because it's a really kind of a cool, interesting thing. But then the idea is that you are talking about that art with the patient first and foremost. And if you can make connections with them, it is through the art. So you can say, you know, do the colors represent anything for you? And then they will start talking about themselves without realizing it. But the art therapist knows the whole time we were always talking about them. They may not know that, but we always knew that we were talking about them. And the other thing, because so much of it is subconscious, is sometimes you come in with an objective view. So, like I could say, I see like those Legos could build a bridge. Maybe it's not there yet, but you think it could build, that could ever happen. And then, you know, the patient would say, no, I don't think that could ever happen. Or, right, or, you know, I'm not ready for that, that's not, or, yes, I think that could be true, maybe that space will get filled in one day, and then how would that feel to have that space filled in again? What do you think? What words come to mind? And so you sort of keep doing that, and if they start to shut down, you go back to the art.
Question, please. You were mentioning the fact that there might be a benefit of shortening the time between the start of the seizure, so condition, whichever, until the surgical operation. So what triggers the actual operation? I mean, is it a request from the person, from the family, or are you expecting the condition to get so, I don't know, so bad, or whatever, that you really think the surgery is now this final option? What triggers the decision, generally speaking, of an operation?
So fundamentally we need to change the mindset of the neurologist. So, because if epilepsy surgery is a good option, then people need to access epilepsy surgery quickly. And so, for example, the NICE guideline for epilepsy is just about to come out in a couple of months here, and it will really advocate for early referral to an epilepsy surgery program. Because the bar for referral to the program is really low. So, try 2 drugs at appropriate dose and you're not seizure free, then you should go into an epilepsy surgery program to be evaluated as to whether epilepsy surgery is an option or not. There is a huge barrier to getting into the surgery program because firstly, those can initially be quite difficult discussions. So sometimes if you're in a busy clinic, people don't want to initiate the discussion about epilepsy surgery because it's going to take you 20 minutes to go through just that first conversation about epilepsy surgery. There's a perception that it is the treatment of last resort, or it actually is the treatment of third resort, because you only need to try 2 drugs beforehand. So that pushes it down. And if you portray epilepsy surgery at that first appointment as well, there's this thing called epilepsy surgery that you could have, but there's a lot of risk associated with it. That can put people off for years. And so then people will go through that medical pathway potentially unnecessarily for several years. There's also sometimes a perception in tertiary centres and outside of tertiary centres that doctors can do things. So it is doing something to give a new medication. Saying, okay, well, I'm going to refer you to someone else is perhaps not doing something. And it's not perceived in quite the same way. But we need to break all of that down because you've heard articulated very eloquently. If you could have epilepsy surgery, especially if you move it earlier and earlier into childhood, for example, then you get back into education, you go through, you avoid all of those things that can happen in adolescence, and that's what really improves life chances. So part of it is, well, a lot of it unfortunately is mindset and just getting that through. And we need it both ways, so doctors need to change, and likewise we want to empower patients. So patients are saying, actually, or people with epilepsy are saying, actually, what about epilepsy surgery? Shouldn't I be evaluated for that? And that will make the change that way as well.
If you say about the changing of medication, so the two changes, but what about in instances where the medication is just being upped and upped? I mean, it's you know, in that instance, it's control. You know, control can happen just through sheer increase.
Sure, you should give two. Get very technical, but so you should give two medications a good go. You know, get to a good therapeutic dose, and you would normally titrate the medications up to maximal tolerated dose for that medication. But if you've done that for two mainstay anti-seizure medications, and someone is still having, as you heard, 200 seizures a year, the answer is unlikely to be, well, we'll go for a third medication. The answer must be, well, let's at least explore other options, which may be surgery, it may be dietary therapy, it may be other options, but let's at least get you into the centres that can explore those options. Put me on a bit of a hobby horse, but okay. Any other questions on that?
Can we change the topic slightly? So I think it is really, there's absolutely fascinating, thank you, and it's, you know, and seeing the journey through it was really powerful. I guess, you know, you seem to reach a really good place. But so I guess I'm wondering what's next. You know, where's your art going now? We've seen this wonderful sort of history, but where is it? Yeah, what are the next things to explore?
About myself?
I don't know.
Well, I'm going to do my doctorate degree is where I'm going next in psychology. So that's where I'm.
So she'll get back to all the nails in that.
But still creating art, presumably, or?
Actually, I would like to do a study on being the differences in disempowered and empowered and how that shows up, because recently there's been changes in how that shows up in the artwork. So I would like to continue to look at how people either get wrapped up or how they are freeing themselves, and how to continue that aspect of how people transition out of that. So
And you've been doing more of the floral, these kinds of things are more recent, right? This has been where she's at, so hopefully it keeps heading in those kind of directions. Not that you can't feel bad emotions. You can feel whatever emotion you want to feel. So.
I know how to validate myself.
I just didn't want to external validation.
Action. But and I think there were some other questions, but just quickly, so in the doctorate, you mentioned burden of normality, and that's a very important concept that are you going to be exploring that in your doctoral work as well? Or?
I am going to probably be involving that in with art, so I don't have all the details figured out yet. I would like to, ideally like to see how that burden is either how people are getting entangled in it, like how I showed up the wrapping and the chains and the yarn, things like that. Because the same pattern has come up with people who have trauma and how they encapsulate versus, and that has been given in a disempowered directive where they keep it closed or tight or chained, and then when you work with them, how that lid opens and how the chains come off. Because if you can help them go through those, you know how to go through those steps, through those layers.
I think those are the most touching.
Yeah. So I just have two questions. Yeah, mostly concerning your art. You focused more on the head. Is there a reason? Except, but you know, the face is, your facial expressions are like almost always the same thing, except when you talked about the eyes. You never talked about the mouth, the smile. You never talked, the expressions were like are always fixated. Is there a reason for that? Like, except for the eyes. I didn't see the face. Of course, the changes around the brain, the head, and the neck, you were fixated. But usually, for human expression, when you're happy, the smile will come. When you are sad, the eyes will be closed and be locked up. But I see that most of the expressions are around, features around the head and all that. That's the first question. The second question is, throughout the years, is there any person or any belief system, is there anything that you held on to that helped you to, helped you through all these processes? A family member, a social, is there something that gave you strength?
Answering your second question first, I have had quite a few people who were very good role models. So some of them who have had epilepsy and have gone on to do extraordinary things, such as doing their doctorate, or have best friends who have their master's degrees. Both of my parents have their master's degrees. I've had amazing supervisors who have been very encouraging. So I always had the mentality that if they could do it, then I could do it too. So I've always had an incredibly high drive to succeed and push myself. Some of that is I had to prove myself though too. Then the facial expressions, I think, is more so that guard coming down. So the layers are more so, there may not have been an expression, but there's not a shield up anymore. So it's more becoming just neutral, natural, human with the plainness of who I am as a person, more so than needing to add more layers of this. The eyes are supposed to be, I can look externally now rather than focus so much internally, but I didn't feel the need to add on any facial expressions because I knew that guard was working on coming down, which was I was so guarded to the point where they weren't getting through anything.
I hate to do this, but I'm going to say, I'm going to stop the questions there and say, mainly because there are drinks and there are some gorgeous artworks. So we've heard a bit about them, but I don't want to not give you time to look at them. I'm sure that these guys will answer questions informally at the end. But thank you all for coming and enjoy the artwork. But most importantly, thank you very, very much.